very good evening to all of you. Am I clearly visible, audible? Everything is good to go? Can you respond in the chat box? Good evening, issue. Am I clearly visible, audible? Thank you. Thank you so much for responding. Thank you. So I welcome you all for today's session. A very good evening to all of you. And today is the last day of immunology. We have started the integrated modules in this batch, the Prof Buster Live Progenitor batch. Okay, the unique feature regarding this batch is integrated modules, in which I'm going to teach you the 3 subjects of the second prof, that is pathology, pharmacology, and microbiology, in an integrated, unique way. So we have started integrated modules, we have completed oncology, and we have started immunology. So today is the last day of immunology. Most of the topics we have already covered, and today the last very important topic we are going to cover today is antigen-antibody reactions. Okay, a must topic in microbiology. Okay, so without wasting any further time, let me share my screen and continue. Okay, give me a second. I guess you can see my screen and we can continue quickly. Okay, so let's start it. So here I am going to continue with the immunology, the last segment of immunology. And today we are starting with antigen-antibody reaction. It's an ultra important, I must say, it's a 5-star important topic in microbiology. Every year you get some or other question on this. And there are many MCQs which are framed on this topic. And this topic is purely conceptual. There is nothing ratification in that. Most of the things you have to understand. Okay, so let's start it. Antigen-antibody reactions. Okay, so I'm going to teach you 10 types of antigen-antibody reactions today. 10 types. Before coming on these 10 types, I will teach you each and every reaction in detail, in much detail. Before coming on these topics one by one, first of all, I would like to tell you certain general features of antigen-antibody reaction which hold goods for all 10 together. So first of all, we will see the general features of all antigen-antibody reaction. Then we will come on the individual types. Okay, so let me tell you general features. So in this diagram, you can see this is antigen. And you can see the 3 antibodies are attached to it. Yesterday, I taught you the antibody structure. Antibodies are Y-shaped in structure. And I told you on the surface of antigen, epitopes are the areas which come in actual contact with the antibody. Not the complete antigen forms bond with the antibody. Not the complete antigen comes in contact with the antibody. A portion of the antigen which actually form bonds, which actually come in physical contact with the antibody, is known as epitope. So you can see I have marked the epitope. The corresponding areas on the antibody which are forming the bond with the epitope are known as paratope. So it is not antigen form bond with the antibody. Yesterday I told you it is the epitope of antigen form a bond with the paratope of the antibody. So it is not antigen antibody reactions actually. It is epitope paratope reactions. Okay, so we have understood what is antigen in detail in yesterday's session. We have understood antibodies in detail in yesterday's session. Today we are going to understand antigen antibody reactions. Okay, so can I start? So before I tell you individual, first of all, we will start with certain general features of antigen-antibody reaction. All antigen-antibody reactions are specific in nature. What do you mean by specific? Yesterday also I told you specific means lock and key hypothesis. Can you open any lock with any key? Of course not. For a specific lock, there is a specific key. We can open a specific lock with a specific key only. Okay, in the same way, it is not any epitope can bind with any paratope. Any paratope. No, it's not like that. A specific epitope bind with a specific paratope because the epitopes have a particular shape. You can appreciate. You can see the shape of this epitope on this antigen. Appreciate the shape. The corresponding shape, the corresponding slot paratope will come and fit here. So epitope paratope reactions are very specific. A specific epitope bind with a specific paratope. It is like a lock and key hypothesis. So first thing, the antigen antibody reactions are specific in nature. Okay, the second property, this is the first property. Okay, now here also you can appreciate the specificity. How many epitopes you can see in this diagram? This is the antigen. The antigen is having how many epitopes? I can see 3 epitopes. The first epitope I can see is triangular in shape. The second epitope I can see is circular, semicircular in shape. The third epitope I can see here is rectangular in shape. Can you see? Now see the corresponding antibodies. So this corresponding antibody is having a triangular slot. This one is having a circular slot. And this one is having a rectangular slot. So a particular paratope is fitting with a particular epitope. Now this antibody will bind here only. It cannot bind here. This one cannot bind here. This one cannot bind here. So this is the meaning of specificity. Give me a thumbs up if you got the meaning of specificity. After specificity, the second property, this is the first property. The second property is cross reactivity. What do you mean by the term cross reactivity? Cross reactivity is opposite of specificity. On one hand, I am saying that antigen antibody reactions are specific in nature. On the other hand, paradoxically, I am saying the cross reactivity also exists. What do you mean by cross reactivity? It means we can open two locks also which are very similar looking, very similar. They are not same, they are very similar in looking with the same key. Okay, so it is cross reactivity. Here you can see this is antigen A. Okay, and you can see the antibody. This is the antibody against A. It is having a slot for A. Okay, you can see this is antigen B. Here you can appreciate this one is antigen B and this is antibody against B. See the colors. You have to appreciate the colors which is given here. Okay, this is antigen A, this is antigen B, but the epitope on A, the epitope on B is similar to that of A. The antigen is different, but the epitope is same. You are getting my point? So here, this is an antigen C. So antigen B and C have similar epitope as that of A, So the antibody against A can react with the epitope of B with the epitope of C. This is anti-A only. This is cross reactivity. So we can open two different similar looking locks with the same key. So that is cross reactivity. On one hand, I am saying for a particular lock, there is a particular key. But if the two locks are similar looking, we can open them with the same key also. So this is cross reactivity. People appreciate my efforts, say that you got it. So first property, antigen antibody reactions are specific in nature. Second property, antigen antibody reaction shows cross reactivity also. These two things are paradox. You have to understand the meaning of them. Got it? Now third property. The other properties are simple. Okay. Antigen antibody reaction takes place at a particular temperature, particular pH, and in presence of electrolyte. So it is not at all temperature, at all pH. So at a specific temperature, specific pH, and in presence of electrolyte, only these reactions occur. Entire molecule do not react. Okay, I mean entire molecule react, fragments do not react. So you can see the complete antigen is coming. Okay, and reacting with complete antibody. This is complete, this is complete. Although a portion of antigen, that is epitope, coming in contact with paratope, but it is the complete antigen which is coming. It is the complete antibody which is coming. So complete antigen and antibody are coming in contact with it. It is the entire molecule. Their fragments are not coming. My point is that. Okay, during this reaction, antigen and antibody denaturation do not take place. None of them get denaturated. Both of them are reactive before the reaction, after the reaction. None of them are denaturated during the reaction. It's a property. Okay. The combination takes place only on the surface. They are not penetrating in each other. Only on the superficially surface they are forming the bond. So this combination takes place only on the surface. Superficial surface they are forming the bond. They are not penetrating inside each other. They are not denaturating during this reaction. Entire molecule is involved. The reaction is taking place in presence of specific pH, specific temperature, and in presence of electrolyte. Both antigen and antibody participate in the reaction. You can see neither alone antigen nor alone antibody reaction is taking place. Both of them are taking part, obviously, in the reaction. Both of them are combining in varying proportion. It is not any fixed proportion that one antigen bind with one antibody. One antigen can bind with any number of antibodies. Okay, but usually one antibody binds with two antigen. Okay, most of the antibodies have a valency 2. You got my point? So this is the antigen. Okay, how many epitopes it is having? Multiple. So how many antibodies it can bind? Multiple. So it can bind with multiple antibodies. There is no fixed proportion. One antigen can bind with multiple antibodies, but one antibody can bind with two antigen at a time. Okay, so valency of antigen is multiple. Antigens are multivalent. But antibodies, most of the time antibodies are bivalent, except IgM and IgA. IgM valency can be 10. Okay, theoretically, practically it is 5. And IgA valency can be 2, can be 4, depending on the serum or secretion. Yesterday I taught you this thing. Yes or no? Got it? So my point is that antigens are multivalent in nature. What do you mean by this term? Antigens are multivalent in nature. One antigen can bind with multiple antibody, but antibodies are bivalent in nature. One antibody can bind with two antigen only. So please learn. So they are combining in varying proportion. There is no fixed proportion. Okay. Which bond is formed between antigen and antibody? Yesterday I taught you. Which bond is formed between antigen and antibody? Name the bond. It can be any bond except covalent. It is known as non-covalent bond. Non-covalent bond. It can be hydrogen bond. It can be electrostatic or ionic bond. It can be van der Waals bond. It can be hydrophobic bond. It can be any bond except covalent. Yes, absolutely right, Rakesh. So say non-covalent bond. Okay, the reactions are firm and reversible. So the reactions are not permanent, they are reversible. They are reversible. So these are the 10 properties I told you of antigen antibody reactions. Can you enumerate the 10 properties quickly with me? Can you enumerate? Today I am teaching you a very important topic, that is antigen antibody reactions. Okay, I'm teaching you a very important topic, antigen antibody reactions. So before coming on individual antigen antibody reaction, I must tell you the general properties. Antigen antibody reactions are specific in nature, like lock and key hypothesis. Okay, they show cross reactivity. It is the paradox. It is the opposite of lock and key hypothesis. Okay, they show cross reactivity. The reaction take place at a particular temperature, particular pH in presence of electrolyte. In this reaction, entire molecule participate. During this reaction, no denaturation of antigen or antibody takes place. The reaction takes place on the surface. Okay, both antigen and antibody are participating in the reaction. They participate in varying proportion. Non-covalent bonds are formed between antigen and antibody, and the reaction is reversible. Give me a thumbs up, everyone. Got it? These are the properties of antigen antibody reaction. Now, does anyone have any confusion? Can we go ahead? Now, the strength of antigen antibody reaction. How to determine the strength of this bond? There are two terms you have to understand. What do you mean by affinity and what do you mean by avidity? See the two terms. I'm talking about two terms, affinity and avidity. See the two terms, affinity and avidity. These are the two terms. You have to understand the difference between the two terms. Most of the students always get confused between these two terms. They are completely different. Please understand. First, you see, these two terms are indicating the firmness of the bond. Firmness, or you can say the strength of the bond between antigen and antibody. So there is an antigen, this is an antigen, okay, and this is an antibody. See, this is an antibody, okay, so they are forming a bond. Can you see this bond? This is the bond between antigen and antibody. So what is the strength of this bond? What is the firmness of this bond? How strong this bond is? Is it a weak bond or a strong bond? That is decided based on affinity and avidity. So affinity and avidity are determining the strength of antigen antibody association. So what do you mean by affinity and what do you mean by avidity? So when one antigen, please understand, when one antigen combined with one antibody, you can see one antigen combined with one antibody, multiple attractive and repulsive forces are there. It is not only attractive. You know, in chemistry we read now many type of forces, attractive and repulsive forces, both type of forces exist. So this is antigen, suppose this is antibody. So when this bond is formed between antigen and antibody, so some are attractive forces between them, attracting each other, and some forces are repulsive, they are repelling each other. Okay, so we take the net force, net of attractive and repulsive force. We take the net of attractive and repulsive force, and that decide the firmness. If attractive forces are more, repulsive are less, so bond is strong. If repulsive are more, attractive are less, so bond is weak. Common sense. You are getting my point. So when an antigen, you can see this is an antigen, it is combining with an antibody, you can see this is an antibody. When antigen antibody combination take place, the bond is formed. Which bond? Name the bond. It is a non-covalent bond. So what is the strength of this bond? The strength of this bond depends on the net attractive and repulsive forces between them. That is known as affinity. So affinity, when a single epitope bind with a single paratope, so the net attractive and repulsive forces is known as affinity. You can see here, it is one epitope binding with one paratope. But in reality, it is not one epitope bind with one paratope. It's not like that. It's multiple epitope binding with multiple paratope. Can you see here? Multiple epitopes are there. These all are epitopes, multiple epitopes. They all are binding with multiple paratopes. Okay, so in reality, multiple epitopes are binding with multiple paratope. So if you take overall repulsive and attractive forces, so overall strength of multiple epitopes and multiple paratope, it is known as avidity. So point is that we have two terms, affinity and avidity. Okay, So both of them are indicating the strength of bond between antigen and antibody. Here we are taking one antigen and one antibody, or rather you say one epitope and one paratope. Here we are taking multiple antigen and multiple antibody, or you can say multiple epitope and multiple paratope. Okay, so we are taking the net of attractive and repulsive forces, net of attractive and repulsive forces. Here the net attractive repulsive force is known as affinity. Here the net attractive repulsive forces is known as avidity. People respond, got it or didn't got it? Anyone have any confusion? I will not say the names again and again. Say, got it? So this is the difference between affinity and avidity. You frequently get question on this. You should understand the terms affinity, avidity. Both of them are indicating the strength, but one is for one bond, I mean one epitope, one paratope, that is affinity. Avidity is for multiple epitope and multiple paratope. Okay, yes. Okay, so let's go. And now let's start the individual reaction. You know the general properties. Now I will teach you antigen antibody reaction. As I told you, I will teach you 10 antigen antibody reactions one by one. What are these 10 antigen antibody reactions? Today only I will teach you all 10. They are very conceptual and difficult to understand. But I will make a fun for you. These all reaction. Okay. What are these 10 reaction? Precipitation, agglutination, complement fixation test known as CFT. Okay. Neutralization, ELISA also known as EA. Immunofluorescence, RIA, that is radioimmunoassay, RIA. CLIA, that is chemiluminescence assay. Okay, and immunochromatography and immunoblotting. So I will teach you all 10 today only one by one. But before starting, the first two are ultra important. If you can read all of them, it's very good, very good. But the first two make a 5-star over them. They are ultra super duper important. Many questions, your MCQs also and university exam questions also, they are framed on the first two. That is precipitation and agglutination. You must understand precipitation and agglutination in detail. Okay, so I will teach you precipitation, agglutination in detail. But before that, I will start all these in the sequence only. I will teach you. The first I will teach you is precipitation. The last I will teach you today is immunoblotting. Okay, I will teach you all them in this sequence. Okay, but before starting these, there is one common point between the first two. Precipitation and agglutination, one common point. That is lattice formation. Lattice formation. So before starting precipitation and agglutination, I must tell you what do you mean by lattice. You must understand lattice formation. If you understand lattice formation, then only you will be able to understand precipitation and agglutination. Got it? So I will teach you all these 10 antigen antibody reaction in detail today only, from first one till last one. But the first two are ultra important. You must understand the first two in much detail. Precipitation and agglutination. And there is one common point between the two, between precipitation and agglutination. What is that common point? The common point is lattice formation. Now you must understand what is lattice. Does anyone know what is lattice? You understand what do you mean by the term lattice? There is a scientist, Marek, who has given the lattice hypothesis, who has first time explained what is lattice and explained the lattice hypothesis. Does anyone understand what is the meaning of lattice? Okay, microbiology apart. What is the dictionary meaning, vocabulary, English meaning of the term lattice? Can anyone answer? Does anyone know what do you mean by the term lattice? Hindi में इसको कहते हैं छत्ता. Okay, or in English, if you want to describe a never-ending structure, a never-ending structure, it keep on growing. A never-ending structure, any structure which can grow forever. This structure is known as lattice. So that is the meaning, vocabulary, English meaning of lattice. Now let me tell you how we are applying this term. How we are applying this term here in antigen antibody reaction, in precipitation and in agglutination. What do you mean by that? Listen. Everyone here. Can you see it? This is antigen alone. This is antigen alone. When the antigen is alone, it's very small, tiny dots are there. We can't see with naked eye. We can't see the antigen with naked eye. With microscope, we can see. But we can't see with naked eye. It's very small, like dot. We can't see that. This is antibody alone. Antibody alone. Alone antibody is there. Again, we can't see it. They're very minute. They're very tiny. With naked eye, we can't see it. We need microscope to see it. Okay, let's combine antigen and antibody. Let's combine the two. So we will get antigen antibody complex. It's like this. You're getting my point? So we are getting antigen antibody complex, which is big in size. Can you see? Can you see the size of one antigen? Appreciate the size of one antigen. Say, ma'am, it's very small. Appreciate the size of any one antibody, anyone. It's like this. Say, ma'am, it's also very small. Appreciate their complex. Appreciate the size of the complex. It's never ending. It keep on growing. So this is lattice. This is lattice. We can see the lattice with naked eye. We can't see the antigen alone. We can't see the antibody alone with naked eye. But once we combine them, we can see the lattice with naked eye even without microscope. Let me give you the best example to understand it. How many of you have performed this experiment in your laboratories? It is blood grouping experiment. How many of you have performed it? People respond, yes or no. You have performed this experiment. I guess in pathology, everyone have done the blood grouping experiment. Yes or no? What do you do in blood grouping experiment? Say what do you do? You take RBCs. These are RBCs. Can you see RBCs? That is your antigen. Your RBC is your antigen, by the way, in this experiment. So can you see RBC with naked eye? So ma'am, no, we can't see RBC with naked eye. We need microscope to see RBC. We can't see antigen. This is antisera. It is antibody. Can you see the antibodies inside the antisera? No, we can't see. We need a microscope to see the structure of the antibody. You combine the two. You take a slide, take one drop of this, one drop of this, mix with a steroid. What do you see? You see dot, 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 dot. Do you see the dot, 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 dot? What are these dots? Once you mix the two, you get dot. Each of the dot is lattice. It is a lattice. You can see with the naked eye because it's an ever-growing structure. It's a big structure. That's why it is looking like a dot. You can't see the antigen alone. You can't see the antibody alone. They are clear. If you see the blood, this one is clear. If you see this one, this is clear. But once you mix the two, you will get dot, 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 dot. Each of the dot is the lattice. People appreciate my efforts. Got it? This is lattice formation. How many of you understood? So this is lattice. So what is lattice? In a lattice, antigen and antibody are keep on binding with each other to form a giant structure. This lattice is a giant. It's a very giant structure. That's why it can be seen with the naked eye. Why lattice is formed? Can you answer it? Why lattice is formed? Lattice is formed because antigens are multivalent. Can you see? I told you, antigens are multivalent. The antigens are multivalent. They can bind with multiple antibodies. And the antibodies are bivalent. Antibodies are binding with two antigens. So let's take few antigens. Let's take few antigens. These all are antigens. Okay. Let's combine them with antibody. So one antibody can bind with two antigens. Okay. This is like this. So multiple antigens will combine together with the help of antibodies. Like this, like this, like this. Okay. Okay. Like this. Okay. Like this. Like this, and it's ever growing. I can still grow it. I can make more antigen here. I can keep on growing, keep on growing, keep on growing. This is lattice. It's never ending structure. How many of you got it? So lattice formation is seen in which of them? If you understood lattice formation, then only you will be understand the zone phenomenon. Can I come on the zone phenomenon? Can I come on the zone phenomenon? You understood what is lattice formation. If you understood what is lattice formation, then only you will be understand the zonal phenomenon. Can I come on the zonal phenomenon? Okay, see these three test tube. Can you see the three test tube in front of you? Can you see it? What you can see in the three test tube? See the three test tube. What is the difference between the three test tube? In each test tube, you can see antigen and antibody. See the proportion of antigen and antibody in each of them. There are three test tube A, B, C. Okay. In the first test tube, I can see only two antigen. Okay. But multiple antibodies. So antibody is an axis. In the first test tube, antibody is an axis. So lattice is not formed. You can see how lattice will be formed. Here, antigen is not sufficient to form the lattice. Antibody is an axis. So lattice is not formed. See the third test tube. In the third test tube, I can see only three antibodies are there. I can see one. I can see two. I can see three. Only three antibodies are there. Antigens are multiple. So again, lattice is not formed. Here antigen is an axis. And again, lattice is not formed. No lattice. Because for forming lattice, we need antibody also. But here antigen is an axis. Antibody is not sufficient. So again, lattice is not formed. See the central test tube. See the central test tube in which antigen and antibody are equal. You can see antigen and antibodies, they are equal. So rather than saying equal, I'm saying antigen and antibody are in proportion. You use this word. They are in proportion. Okay. So here lattice is formed. Okay. So my point is that when antigen is an axis, lattice do not form. When antibody is an axis, lattice do not form. Lattice only form when antigen and antibody are in proportion to each other. Okay, and this is known as zonal phenomenon. This zone is known as zone of equivalence. This zone is known as zone of equivalence when antigen and antibody are in proportion. This zone is known as zone of equivalence. When antibody is in axis, it is known as prozone. Here, lattice do not form. In prozone, there is no lattice. When antigen is an axis, it is known as postzone. In postzone also lattice do not form. Neither in prozone nor in postzone. Where does the lattice form? Lattice form in zone of equivalence, where antigen and antibody are in proportion. Don't say the word equal. Here I have taken why I'm using the word proportion, not the equal. You must have asked the question. No, I don't know why you people don't ask the question even in live class. You should ask this question. Okay, ma'am, why you are not saying antigen antibody, they should be equal? Why you are using the word proportion? What's the difference? The difference is that they should be equal if antigen and antibody both are bivalent. My point is that antibody is always bivalent. One antibody can bind with two antigen. It is fixed. But antigen can bind with any number of antibody. Antigens are not bivalent, they are multivalent. In this diagram, antigen and antibody both are bivalent. You can see one antigen is binding with two antibody. You can see each antigen is binding with two antibody. Okay, and each antibody is also binding with two antigen. Each antibody is also binding with two. That's why they are equal here. It is not always necessary. Okay, so whatever is their ratio of their valency, they should be there in that proportion. Then only lattice will be formed. Lattice is formed if antigen and antibody are in that proportion in which their valency is there. Okay, antibodies are bivalent, but antigens are multivalent. Okay, they can be 2 valent, 3 valent, 4 valent, 5 valent, 6 valent, 10 valent, 20 valent, 100 valent. So whatever is the proportion of their valency, they should be there in their proportion of their concentration. Their concentration should be in that proportion. Then only the lattice is formed. How many of you got this concept? So that is the zone of equivalence. That is zonal zone of equivalence, zonal phenomenon. You can see again the same concept. You can see the 3 test tube. So when antibody is an axis, lattice is not formed. It is known as prozone. When antigen is an axis, again lattice is not formed. It is known as postzone. But when antigen and antibody are in proportion, lattice is formed and it is known as zone of equivalence. Give me a thumbs up, everyone. Each and every one of you got it? So this is zonal phenomenon. Okay, this is zonal phenomenon. Let's do an experiment to prove it. Can I do an experiment to prove it? Let's take how many test tube? 6 test tube. Can you see the 6 test tube? I have taken a set of 6 test tube in front of you. Okay, now in each test tube, what I am putting? In each test tube, I am putting fixed antigen. Suppose 1 unit of antigen. The lower portion is this antigen, the red dots. So 1 unit antigen everywhere. So antigen is fixed amount of antigen in all the 6 test tube. In all the 6 test tube, I am putting fixed amount of antigen. Can you see the fixed amount of antigen? What about antibody? Now in the first test tube, I am putting antibody as a proportion of 1, the complete antibody. In the next, I am putting half of this. In the next, I am putting half of even this. In the next, I am putting half of even this. I mean, in the first test tube, I am putting antibody as 1. In the next, I am putting 1 by 2. In the next, 1 by 4. In the next, 1 by 8, 1 by 16, 1 by 32. This process in which in the next test tube, I am putting the antibody half of the previous one. In the next, I am putting the half of the previous one. This is known as serial dilution. Got it? So basically, we are doing serial. So you can see in the diagram also. See the proportion of antibody here. Okay, whatever is the proportion here, it is half of that. Whatever is here, it is half of that. Whatever is here, it is half of that. Half of that. How many of you got it, people? So this is like that. So basically, in the first test tube, so we are having 6 test tube now. In the first, basically, antibody is an axis. So here, the lattice will not form. In the last test tube, antigen is an axis. Again, lattice will not form. So lattice will not form in the first few test tube, in the last few test tube. Lattice is formed in the middle test tube. Where is the lattice formed? At the junction of antigen and antibody. Can you appreciate the junction of antigen and antibody? Appreciate it. Appreciate the junction of antigen and antibody. Can you see a ring is formed at the junction of antigen and antibody? This is lattice. This ring is actually lattice. Okay, so we are mixing the antigen with the antibody in some test tube, in some central test tube. We are getting the ring at the junction. This ring is actually a giant structure. That is lattice. How many of you got it? First you say you got it or you didn't got it. Then only I will proceed. So we are getting the lattice in the central test tube. The initial test tubes are showing prozone. That's why the lattice is not formed. The last test tube is showing postzone. That's why lattice is not formed. The central few test tubes are showing zone of equivalence. Okay, that's why lattice is formed in central few test tube. Okay, the last test tube in which you can see the you can see the lattice. How many test tube is showing the lattice here? In this experiment, 3 test tube are showing the lattice. I can see the ring here, I can see the ring here, I can see the ring here. So the last test tube in which the ring is seen, that is known as the titer of the experiment. So for this experiment, the titer is 1/16. This is the meaning of the titer. Okay, I will use this term frequently when I will start the systemic microbiology, the titer of the reaction. So students even don't have knowledge what the term titer means. This is the titer. So titer means the last test tube in which we are getting that zone of equivalence. So that is the meaning of the titer. I hope you all got it. Okay. So this is the thing. So we are taking multiple test tube. We are putting a fixed antigen in all of them. And then we are doing serial dilution of the antibody. By the term serial dilution, I mean in the next test tube, the antibody is the half of the previous one. This is the meaning of the serial dilution. So in the initial test tube, antibody is in excess. So no ring is formed. That is prozone. In the last test tube, last few test tube, okay, antigen is in excess. So again, no ring is formed. That is postzone. But in the middle few test tube, antigen antibody become equal to each other. So ring is seen and it is zone of equivalence. Okay, this one is zone of equivalence. So this is zonal phenomenon. Now the point is that how you will learn. Let's make a graph. You can see, I will give you a mnemonic also. See, can you see this graph? In this graph, you can see the three diagrams again. See this diagram, this diagram, this diagram. Okay, in the first diagram, you can see antibody is an axis. So no lattice. In the last diagram, antigen is an axis. So no lattice. In the central diagram, antigen is equal to antibody. So lattice is formed. So lattice is maximum in the zone of equivalence. Okay, in the prozone and in the post zone, lattice is not there. So prozone is antibody axis and post zone is antigen axis. How to learn that? How to learn that? Okay, how to learn that? In the zone of equivalence, in the zone of we are taking the concentration equal or in proportion. But how to learn that prozone is antibody axis and postzone is antigen axis? How to learn that? I'm having a mnemonic to learn that. Okay. How you write antibody? We write like AB. Everyone like antibody like AB. How you write down antigen? We write down antigen as AG. Okay. We all write like this only. So when we say ABCD, which comes first? B comes first or G comes first? A is common. B comes first or G comes first? I'm asking you. A, B, C, D, E, F, G, H. So B is coming first. So basically, antibody axis is prozone. Pro means first. Okay. And antigen axis is post zone. Post means later on. Now you will never forget. Now you will never forget. You get question on that. That antibody axis is known as prozone and antigen axis is known as post zone. And when both are equal or in proportion, it's zone of equivalence. How many of you got it? So learn this trick. Learn this mnemonic. You will never forget for your MCQs. Okay. So let's start the antigen antibody reaction with this overview. I taught you lattice phenomenon and zonal phenomenon. Lattice phenomenon and zonal phenomenon is seen in first two. Out of the 10, I will teach you 10 antigen antibody reaction today. Out of these 10, the first two, which first two? That is precipitation and agglutination. Both of them show lattice formation. Lattice is formed only in these two, not in others. Not in others. Since the lattice is formed in the first two, so zonal phenomenon occurs in the first two. Zonal phenomenon, that is the three zones exist. Prozone, zone of equivalence and postzone occurs in precipitation also and the three zones occurs in agglutination also. Okay, so let's start precipitation agglutination one by one. What you're asking, Dr. Sandeep, we can put half solution subsequent to, but how much time we can take to put the solution? There is no limit for this time mentioned. Whatever time you can take, no? Like you don't have to disturb the test tube. If you tilt the test tube or disturb the test tube, the ring will disappear. You have to keep it still on a stand and you have to quickly put it. You are just quickly putting the half in all of them. Okay, so whatever concentration you are putting here, you in the next test tube, you just put half of that. In the next, the half of that. There is no time mentioned anywhere for this process to take place. Okay, chalo. So let's start it. Can I start? Can I start the first two? So out of the 10, I'm starting with the first two reaction. Let's start it. Precipitation and agglutination. Can we start, people? Precipitation, agglutination. So what is the difference between precipitation and agglutination? What is the difference? Does anyone know what is the difference between precipitation and agglutination? Yes or no? In both of them, there is an antigen. In both of them, there is antibody. So let's make an antigen. This is antigen. Okay. Let's make antibody. This is antibody. So what is the difference? One is precipitation, one is agglutination. You will say, ma'am, how to differentiate? Both have antigen, both have antibody. Both are antigen-antibody reaction. How to differentiate? Listen my word. It is the physical nature of antigen, not antibody, who is going to differentiate. The antigen can be solid, the antigen can be liquid. Suppose the antigen is liquid. Okay, so this reaction is known as precipitation. Precipitation. In precipitation, the antigen is liquid. And suppose the antigen is solid in nature. So the same reaction will not know, it is not known as precipitation now. The same reaction is known as agglutination now. Agglutination. So in agglutination, the antigen is solid. Okay, so it is the physical nature of antigen that's going to decide the nature of the reaction. Whether the reaction is precipitation or whether the reaction is agglutination, it depends on the physical nature of the antigen. Okay, so instead of calling liquid antigen, say a soluble antigen. The meaning is the same. Say a soluble antigen. And instead of saying solid antigen, okay, say particulate. The meaning is same, but you use the word particulate. For your understanding, I use the word liquid and solid. But better will be the definition if you use soluble and particulate word. So what is the definition of precipitation and agglutination? People say, what is the definition of precipitation and agglutination? What is precipitation? Say, ma'am, when the antigen is soluble in nature, that is liquid in nature, the reaction is known as precipitation. And when the antigen is particulate in nature, okay, that is solid in nature. For your understanding, solid. Okay, the same reaction is known as agglutination. Give me a thumbs up, everyone, each and every one of you. So this is the definition of precipitation and agglutination. Is the speed is good? You are getting everything? Give me a thumbs up. Got it? Got the definition of precipitation and agglutination? So the same thing is written in front of you. So when the antigen is soluble, it is reacting with the antibody, soluble antigen, it is known as precipitation. When the antigen is particulate, it is reacting with the antibody. The same reaction is known as agglutination. Okay. Precipitation, also known as flocculation. Precipitation, also known as flocculation. Learn it. Precipitation and flocculation are same. The precipitation and flocculation, both of them are same. Okay, they are synonym, you can say. But agglutination is different. Okay, give me a thumbs up, people. Everyone got it or didn't got it? Okay, either say that you got it or ask your doubt. So this is the definition of the two. Now, one by one, I will take and tell you the details. So let's start with the first one, precipitation. I'm starting with the first one, precipitation. Definition you have to tell me only two things, precipitation or flocculation. Let's start it. Precipitation or flocculation. Definition, you already know. I will tell you the types now. What is the definition of precipitation? Who will tell me the definition? So it is how you have to define. When a soluble antigen is combining with the antibody in presence of electrolytes, suitable temperature, suitable pH, then antigen-antibody complexes are formed. Okay, and then it is known as precipitation or flocculation. Now, there is a little bit difference between precipitation and flocculation, both of them. When the antigen-antibody complexes are formed, okay, when these complexes are formed in gel, it is known as precipitation. And when these complexes are formed in liquid medium, it is flocculation. You have to see the background. Can you appreciate the background? Can you appreciate the background? These are antigen-antibody complexes. Please understand. Please understand. So let's take an antigen. This is my antigen. My antigen is soluble antigen. Mind my words. Soluble. Soluble means liquid antigen. It is reacting with the antibody. Okay, so this is antigen-antibody reaction. Okay, now is it precipitation or is it flocculation? Who is going to decide? I told you precipitation and flocculation is same, but there is little bit difference. It depends on the background. Background is what? It depends on the background. In which background this reaction is taking place? The background. The background matters. Okay, if this reaction is taking place in gel, call it as precipitation. And if this reaction is taking place in a liquid medium, the background is a liquid medium, call it as flocculation. Okay, I'm doing a really hard efforts to explain you the fine details inside the concepts, inside these all. Okay, so please understand, in both of them, mind my words, in both of them, whether you say it's precipitation or whether you say it's flocculation, in both of them, the antigen is soluble. The antigen is soluble. In agglutination, the antigen is particulate. Here in both of them, the antigen is soluble. It is the background which is differentiating them. I hope you are getting it. Okay. So if you are getting confused, you can consider them synonym. But if you want to know the exact difference between them, I have told you. Otherwise, you can consider them as synonym. They are same. In both of them, the antigen is soluble. The antigen is liquid in nature. It is reacting with its antibody and forming the antigen-antibody complexes in presence of a suitable temperature, suitable pH, in presence of electrolyte. So define, it is asked in Viva, define precipitation. So say, ma'am, when a soluble antigen, stress the word soluble. Highlight the word soluble. When a soluble antigen react with its antibody in presence of suitable temperature, suitable pH and electrolyte, then antigen antibody complexes are formed. So these complexes are formed in which background? In gel, it is known as precipitation. And if the background is liquid, it is known as flocculation. This is how you have to define it. Now coming on the types. Definition, you got it. Okay, you got the definition of precipitation as well as flocculation. Now I'm coming on types. There are 5 types of precipitation. You have to understand it. So there are 5 types of precipitation and 4 types of agglutination. Okay, I am sure many of you even don't know their names and you don't know the difference between them. You have to understand the 9 types total. Okay, so both of them have one thing in common that I have already told you, the lattice phenomenon. Lattice phenomenon is seen in both of them. Zonal phenomenon is seen in both of them. So if in your university exam whether precipitation is asked or whether agglutination is asked, you have to write the lattice phenomenon and zonal phenomenon in both of them. Prozone, zone of equivalence, postzone in both of them. This also, it holds good for both of them. So zonal phenomenon and lattice phenomenon holds good for both of them. So write the definition of both of them, write the lattice phenomenon and zonal phenomenon in both of them, and then you can come on their types. You can come on their types. So precipitation is having 5 types and agglutination is having 4 types. One by one we will discuss. So let's come on the types of precipitation. The 5 types. 5 types of precipitation. First I'm teaching you precipitation. After that I will come on agglutination. So I'm teaching you the 5 types of precipitation quickly. So ring test, slide test, tube test, immunodiffusion, okay, and electroimmunodiffusion. It is immunodiffusion. This one is electroimmunodiffusion, also known as electrophoresis. Okay, the 4th one, that is immunodiffusion, is further of 4 types. So one by one we will discuss them in detail. Let's start the first one, ring test. So this is the final table. We are going to revise all 5 together here. Ultimately you have to learn this table. One by one we will take. So let's start with the ring test. The first one, ring test. Let's start with the first one, ring test. The 5 types. Okay, let's start with the first one, ring test. What do you mean by ring test? It's very easy. I guess you have done this experiment in your laboratory. Everyone must have done it. So we are taking a test tube. Appreciate it. Okay. In this test tube, we are taking a soluble antigen here. Soluble antigen. Mind my words. We are taking a soluble antigen at the bottom. So here we are filling it with a soluble antigen. This one. Appreciate it. Okay. Over it, I'm putting antibody. I'm putting antibody. So when I mix the soluble antigen with the antibody, please understand it. The lower portion of the test tube is having antigen access. The upper portion of the test tube is having antibody access. But where antigen and antibody are meeting, at that portion, they are in proportion. So when they meet, where they meet at their junction, wherever their concentration will be in proportion, they will form a lattice. And the lattice is seen in the form of a ring. So at their junction, we can see a ring, and that is known as ring test. Ring is actually a lattice. Chatta, lattice. I have shown you the diagram of ever growing structure. No? So that lattice is seen with naked eye. Can you see the antigen? No, it's clear. Can you see the antibody? No, it's clear. But at their junction, can you see a ring with naked eye? Yes, we can see the ring with naked eye. Why? Why we can't see antigen, we can't see antibody, but we are seeing the junction with naked eye? Because junction contain the lattice. Appreciate. Junction contain the lattice. So this is ring test. So we are taking antibody. We are putting soluble antigen over it. So actually this one is antibody. I have told you reverse. This is antibody and this is antigen. Okay, soluble antigen. At the junction, you will see a ring. The ring is actually a lattice. So this is ring test. Nothing important. This is ring test. You can understand. Basically, you have to learn the examples in each category. Okay. I will teach you systemic microbiology system-wise. Okay. After immunology, we are going to start with CVS. We will do the inauguration with CVS. So one by one, I will teach you all bacteria, all virus, all fungus, all parasite in the next 2 months. Right. Total 150 organisms are there in microbiology. I will teach you each and every microorganism. Okay. So these all tests will come there. Right now, I want you to just learn that in which category they are coming. So when I will teach you Bacillus anthrax, I will teach you Bacillus anthrax. Okay. So when I will teach you Bacillus anthrax, there I will teach you there is a ascolin thermoprecipitant test in Bacillus anthrax. So that comes here in this example. Ring test. We perform ring test in Ascoli's test. When I will teach you Streptococcus. Okay. I will teach you Streptococcus. So there I will teach you we do the Lancefield grouping of Streptococcus to classify Streptococcus. That is also an example of ring test. So learn 2 examples of ring test. I taught you what is ring test. I'm teaching you the types of precipitation. The first type of precipitation is ring test. So you know how to perform it. It's very easy how to perform it. Tell me 2 examples. So tell me the name of bacteria, two bacteria, Bacillus anthrax and Streptococcus. So in Bacillus anthrax, the name of the test is Escolin thermoprecipitant test. And in Streptococcus, the name of the test is Lancefield grouping. Lancefield grouping, you get MCQs on that. People understand. In your exam, you get Escolin thermoprecipitant test is an example of what? It is an example of ring test, slide test, tube test, like that you get the example question in your exam. So you should learn this is the example of ring test. Ascol is thermoprecipitant and Lancefield grouping. Ascolin thermoprecipitant in Bacillus anthrax. Learn the bacteria also. And Lancefield grouping in Streptococcus. Learn the bacteria also. So coming on the next one. Ring test is done. Learn its two example. Procedure is nobody is going to ask. In your university exam, sometimes they can ask you to write the procedure, but it's easy. Procedure, diagram, example. That's it. See the procedure, diagram, example. Coming on the next is slide. It is exactly same. Instead of test tube, we will do the experiment on a slide. Have you done blood grouping? It is like that only. It is not blood grouping. Blood grouping will be agglutination. People, blood grouping, how should I explain you? In blood grouping, what is your antigen or what is your antibody? Who will tell me? Have you done blood grouping? I guess everyone have done. I'm asking a question. What is the antigen and what is the antibody in blood grouping experiment? I'm asking. Who will answer? Kim, Rakesh, Soumya, Sandeep, Priyanka, Sanskriti, anyone who is live. Many students are live. Can you tell me what is the antigen and what is the antibody? Antibody is antisera. Antisera A, antisera B, antisera. Antisera is antibody. Yes, Rakesh. What is antigen? Antigen is going to decide, no, is the precipitation. So blood mein kya? What is there in the blood? Kim? Yes, RBC. Yes, say RBC. Okay, so our antigen is RBC. Okay, against which we are taking the antisera. Okay, the antigens are present on the cell. So my question to you, RBC is solid or liquid? RBC is solid. I mean, RBC is soluble antigen or a particulate antigen. Okay, better language. Soluble antigen or particulate antigen? RBC is a cell. RBC is a cell. It's solid. It's not liquid. It's solid. It's particulate. So you yourself decide. Blood grouping is precipitation or agglutination. Now you answer. Is it particulate? So is it precipitation or agglutination? Blood grouping will come in the example of agglutination. Of course, common sense. Everything have a reason. If you think logically, everything have a reason. So blood grouping is an example of agglutination. It's not precipitation. Okay, currently I'm teaching you precipitation. Currently, these are the 5 types of precipitation. After that, I will come on agglutination. There I will teach you blood grouping. Okay, so here we have done ring test. Now we will do slide test. I'm saying we are doing slide test and precipitation in the same way like blood grouping and agglutination. So we are taking a slide. We put 1 drop of antigen, 1 drop of antibody. Okay, and we are mixing them. So on a slide, let's take a slide. I don't have it. Suppose this is a slide. So take 1 drop of antigen, 1 drop of antibody, mix it with a stirrer. Once you mix it with a stirrer, you see dot, 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 dot. Alone antigen, you can't see. Alone antibody, you can't see. Mix it with a stirrer, you see dot, 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 dot. Each dot is a lattice. So instead of test tube, you are doing it on a slide. In the test tube, the lattice was seen in the form of a ring. Here, the lattice is seen in the form of a ring. In the slide, the lattice is seen in the form of dot, 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 dot. Each dot is a lattice. So that is the slide test. So we are taking 1 drop of soluble antigen and mixing it with 1 drop of antibody. Mix it, 1 drop, stirrer. You will get dot, 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 dot. That is slide test. The best example here is VDRL test of syphilis. You have to learn it. Examples, you have to learn it. When I will teach you syphilis, now we will perform this experiment on a slide. VDRL test of syphilis. So we are done with ring test. We are done with slide test. You know the procedure, you know the diagram. Basically, you know the examples. The third is tube test. We are done with ring test. We are done with slide test. Can I come on the tube test? Keep interacting, people. Can I come on the tube test? So what we are doing in the tube test? In a tube test, we are taking a set of test tube. Maybe 6 test tube or 8 test tube. A set of test tube, not 1 test tube. We are taking a set of test tube. I have already explained you. In all the test tube, we are putting fixed amount of soluble antigen. Fixed amount, 1 unit. 1 unit of soluble, mind my words, soluble antigen in all of them. Okay, and we are putting serial dilution of antibody. So here antibody is 1, here half, here 1/4, 1/8, 1/16, 1/32. That is serial dilution of antibody. So initial test tube don't show the ring. Last test tube don't show the ring. Because here antibody is an axis, that is prozone. Here antigen is an axis, that is postzone. The ring will be seen in the central few test tube. And the last test tube in which ring is seen will tell us the titer. So this is tube test because we are taking a set We are taking a set of test tube and we are getting the titer there. So this is known as tube test. The same thing is written. Whatever I have explained you, write down in a flowchart. My teaching people, my complete teaching is flowchart. I teach everything in the form of flowchart and diagram and bullets. Okay, no paragraph in my teaching. You may have noticed this thing, right? So for everything, draw a flowchart. It will be easy to understand step by step, everything. You can draw flowchart of actually anything. So that in your mind, now your mind get trained to take the things in steps, to understand the things in step, and it will be easy. If you try to, read anything in paragraph, you will forget. But if you try to read anything in flowchart now, retention will be longer. Try this strategy. Okay, so what we are doing here, try to describe it. Take a set of test tube, 6 test tube or 8 test tube. Take constant antigen in all of them. But mind it, the antigen should be soluble, 1 unit in all of them. You add serial dilution of antibody. That is, you are doing half of the antibody in all of them. Serial dilution. Okay. So the middle test tube show the antigen antibody in equivalence. So in the middle test tube, the ring will be there. The highest dilution is known as titer. Here the example is Kahan test of syphilis. Now mind my words. So this is also syphilis. This is also syphilis. VDRL test of syphilis is done on slide. And Kahan test of syphilis is done in test tube. So VDRL is an example of slide test and Kahan is an example of tube test. Getting it? Coming on the fourth one. The fourth one is difficult, immunodiffusion. How many of you got it? So I have done ring test in single test tube. I have done slide test on a slide. I have done tube test in a set of 6 test tube. Okay, but please understand, here if I tilt the test tube, the ring will disappear. Okay, here the slide will dry after some time and I have to throw it. Okay, here also I will tilt the test tube, the ring will disappear. Okay, so here, documentation is not there. Suppose, okay, I'm doing this experiment in my laboratory. I'm a microbiologist and I'm doing this experiment in my laboratory for the patient sera. And I got the ring and I will document that the ring is present and the patient Ascaris test is positive or this test is positive. So patient is positive for Bacillus anthrax. But I don't have any documentation. No, ultimately this will tilt and I have to throw the test tube. This slide will get dry. I have to throw it. This test tube, I have to throw it. I cannot keep it forever. Once they will tilt or they will I will shake it, the ring will disappear. There is no documentation. For documentation purpose, these are not good. All three are not good. For documentation, we have to perform the experiment in gel. We can keep gel forever. We will take agar gel. So here we will do the precipitation in gel now. Here we were doing the precipitation in tube or slide. Now we will do precipitation in gel. That is immunodiffusion. Immunodiffusion is precipitation in gel. What is immunodiffusion? Precipitation in gel. For documentation. We can document it. How many of you are getting it? I don't know. So we will do the precipitation in gel. Okay, I will have the documentation. Suppose I will give the patient is positive and the titer is this. But I don't have. Suppose tomorrow the patient is claiming on me that show me where is my positive test. Any test it can be. So I don't have any documentation in my laboratory to show, see, I have done the test and it is positive and this is the titer. We should have documentation of everything now so that we can show the patient and we can keep in the records that the titer is this or whatever. The test is positive or negative. Okay. So here we cannot do the documentation because we cannot keep the test tube forever. Ultimately, they will dry someday. And once they will shake or little bit tilted, the ring will disappear. Zara sa bhi hilega to gayab ho jayegi ring. We cannot keep it still forever. We cannot do so. So we will perform the same experiment in gel now. That is known as immunodiffusion. You are getting it? That is immunodiffusion is precipitation in gel. There are 4 types of immunodiffusion. Immunodiffusion is of 4 types. So this is the 4th type. This is the 4th type of precipitation and this further is of 4 types. Okay, so can I tell you the 4 types of immunodiffusion? Are you people with me? Are you interested in knowing the types of the immunodiffusion or shall I leave it? Shall I directly come on the last one? You must understand the 4 types here. The 4 types of immunodiffusion. They are difficult to understand. I'm warning you. So please concentrate. What are the 4 types of immunodiffusion? Single diffusion in 1 dimension, double diffusion in 1 dimension, single diffusion in 2 dimension and double diffusion in 2 dimension. These are the 4 types. Okay. In the bracket, the scientists who discovered them, their names is written. Like single diffusion in 1 dimension is known as Orden procedure because it is discovered by Orden. Double diffusion in 1 dimension is known as Oakley Fulbrough procedure. It is discovered by Oakley. Single diffusion in 2 dimension, radial immunodiffusion. Double diffusion in 2 dimension, outer Loney procedure. You have to learn the name of the scientist. Sometimes they are asked in the exam with these names also. So you must be aware. But you will say, ma'am, what do you mean by single double, diffusion, dimension? It's totally confusion. It's very easy. If you understand it conceptually in a people, it's very easy. So let me start one by one. Can I start? Let's start with the single diffusion in one dimension. Let's start single diffusion in one dimension, that is odd in experiment. See, what we are doing. It's very easy. It's very easy. Okay, let's take a test tube. Let's take a test tube. Okay, fill it with agar. You know what is agar? Agar is something, you heat it, it becomes liquid. You cool it, it becomes solid. You know, it's like ice and water. Agar have a very unique property. You heat the agar, it will become liquid. You cool the agar, it will become solid. Please learn this property of agar. Okay, so what you will do, take a test tube. Take a test tube. Imagine you are doing this experiment, you are taking a test tube. Okay, fill it with agar, liquid agar, heated agar. Fill it with agar. So I am filling it with agar. This is agar, plain agar, and I am heating this agar. Okay, once I heat it, it become liquid. It become liquid. Once it become liquid, I am adding antibody, my antibody inside it. So I have incorporated, and I'm mixing it with a stirrer. So antibody get incorporated everywhere. I'm uniformly mixing it. It become liquid now. I'm uniformly mixing the antibody with a stirrer inside that. And after that, I'm again cooling it. Okay, now I will not call it agar. I will call it antibody incorporated agar. What I will call it? Antibody incorporated agar. Okay, in the textbook, you will directly get this name. A student even don't understand what is this, from where we bring it. I told you the steps how we are making it. So take agar, heat the agar, mix antibody in that, mix it with a stirrer, uniformly distribute it and cool it. So such agar is known as antibody incorporated agar. How many of you got it? Now over it, put your antigen. This is my antigen. I'm putting antigen, soluble antigen. Over it, put your soluble antigen. This is my soluble antigen. Over it, I'm putting the soluble antigen. Okay, over it. So you say which will move? Antibody will move or antigen will move? This is antibody present in the agar, and this is antigen. Who will move? So antigen will move. Only antigen. And where it will move? It will move downwards. So in this portion, antigen is an axis. In this portion, antibody is an axis. You are getting my point? So antigens start moving downwards. It will start moving downwards. The molecules of the antigen, they will start moving downwards inside the agar. Okay, and the reason where their concentration will become equal or proportional, at that point you can see a line. A line will be there. A line will be drawn. You can see a line. This is known as line of precipitation. This is like the ring in the test tube. Okay, at the junction we can see ring there, na? Okay, where their concentration was becoming equal. Here inside the agar, wherever the concentration of the antigen and antibody, in this area the concentration of antigen is more, so it is postzone. In this area the concentration of antibody is more, in the lower area, so it is prozone. Okay, but in certain position their concentration will be equal or proportional. At that place the lattice will be formed, and the lattice will be seen in the form of line or band, whatever you call, band of precipitation or line of precipitation, whatever you say. So this will be forever. I can keep it for my records. It is same as that of ring test, but we are performing it in gel. So basically here the ring is formed inside the gel. You are getting my point? So you tell me out of the two things I'm having, antigen and antibody, how many of them are moving? Antibody is not moving, only antigen is moving. Only antigen is moving. Okay, and that too in one dimension. It is moving downwards in one dimension. So that's why I'm saying single diffusion. Only one person is moving. One thing is moving. Single diffusion in one dimension. So it is known as single diffusion in one dimension. Single diffusion in one dimension. How many of you got it? Huh? So same thing is written. So take agar, incorporate antibody in that. You got it? Incorporate antibody inside the agar. Okay, this one is antibody incorporated agar. Put soluble antigen over that. Put soluble antigen over that. You will see antigen is going downward. Only antigen, not the antibody. Antigen is going downward. And wherever their proportion become equal, you can see a band of precipitation is formed. Appreciate this band of precipitation. So it is known as single diffusion in one dimension. Can I come on double diffusion in one dimension? People, you have to respond that you got it or you didn't got it. So double diffusion in one dimension, which is known as Oakley full broth procedure. So let me tell you what we are doing here actually. Okay. So again, we are taking a test tube. Okay, we are taking a test tube. We are putting agar. we are heating the agar, we are incorporating antibody inside that and cooling it. So basically we are taking antibody incorporated agar. This is antibody incorporated agar I have taken. As usual, till now we were doing it the same. Now over it, I am putting plain agar. This is plain agar. This is plain agar. Plain agar containing nothing. Solid plain agar. Okay. This one is antibody containing agar. Antibody containing agar. This one is plain agar. Over this one, I am putting my antigen. Soluble antigen. This is my soluble antigen. Now you tell me who will move. Say, ma'am, antigen will also move due to concentration gradient. Antigen obviously will move, and antibody will also move due to concentration gradient. Both of them will move. It's double diffusion because both are moving towards the plane agar. So antigen is also moving downward, antibody will move upward. Okay, because of their concentration gradient. So at one place, at certain place, their concentration become equal, and at that point the band will be formed. At that point the band will be formed, band of precipitation. So here, since two people are moving, two things are moving, antigen also moving, antibody is also moving, it is known as double diffusion, but both of them are moving in one dimension. One is downward, one is upward. Okay, in one dimension. So it is double diffusion in one dimension. People got it? Double diffusion in one dimension. So this is double diffusion in one dimension. I hope you got it. The experiment is same, but we are taking plain agar in the center. That's it. So here antibody incorporated agar is taken in the test tube. Over it, plain agar is taken. Okay, over it, antigen is taken. Okay, so antigen is moving downward, antibody is moving upward. At the junction, we can see a band of precipitation. So this is, you can see, this is double diffusion in one dimension. So you can appreciate this is single diffusion in one dimension. This is double diffusion in one dimension. You can see the difference. How many of you got it? Raise your hands. How many of you got it? What do you mean by single diffusion? What is mean by double diffusion? Both of them are in one dimension because they are inside the test tube. They are moving either downward or upward. Downward, upward is one dimension. Yes, respond. Say. Everyone? What about others? So you can see here, the only difference, we have taken plain agar at the center. Here there is no plain agar. Okay. So single diffusion in one dimension, double diffusion in one dimension. Now we are coming in single diffusion in two dimension and double diffusion in two dimension. Okay. Let me explain you single diffusion and double diffusion in two dimension. What do you mean by two dimension? For two dimension, we have to take a Petri dish. One dimension takes place in test tube, but two dimension, we have to take a Petri dish. So let's take a Petri dish. So let's take a Petri dish. This is a rectangular Petri dish in which I am putting the agar. I am heating the agar. I am incorporating antibody in that. So again, this is my antibody incorporated agar. This contains antibody. This is antibody incorporated agar as usual. Antibody incorporated agar. Okay. And I'm cooling it. So it becomes solidified. Now I will cut well. I will cut wells in that. Well, you know, small wells, holes. I'm cutting small wells in that, small holes. And I will fill antigen inside this. I will fill my antigen inside this. This is my antigen, the soluble antigen. I'm filling the soluble antigen in these wells. Now you tell me who is moving and where it is moving. Antibody is everywhere. It will not move. It is in the background. It will be everywhere. But antigen will move. So this is the antigen which is moving radially. Okay, in two dimension it is moving. Radially means two dimension. Okay, now the antigen is moving radially and it is in two dimension. So in the well, the concentration is the highest. It will keep on moving. So at certain point, antigen antibody concentration will become equal or in proportion. At that point, the arcs are formed. These are known as arcs of precipitation in the form of the circles. The arcs are formed. Okay. And that is indicating the reaction is taking place. So you can appreciate the arcs. Appreciate. The antibody is everywhere in the background. It is antibody containing agar. Antibody is everywhere in the background. And you are cutting the wells. From the wells contain the antigen. From the wells, the antigen is moving radially. Since the antigen is moving, only one thing is moving, it's single diffusion. But it is moving in two dimension, I mean radially. So it is single diffusion in two dimension. Antigen is moving radially. Okay, the last one. Double diffusion in two dimension. What do you mean by double diffusion in two dimension? Again, take a Petri dish. Again, you take a Petri dish, rectangular Petri dish, fill it with plain agar. Mind my words, this is plain agar. For double diffusion, you have to take plain agar always. It is plain agar. In this, now we will cut the well. So let's cut a central well and peripheral well. Central well and peripheral well. In the central well, you fill antibody. you fill antibody. And in the peripheral well, you fill antigen. What will happen now? Use your common sense and tell me what will happen. In the peripheral well, you fill antigen. In the central well, you fill antibody. In the peripheral well, you fill antigen. What will happen now? You tell me. So antibody, who will move? Both will move. So antibody will also move like this. Antibody is moving and antigen is also moving like this. Okay, all antigens. Antigens are also moving because it is plain agar. Both are moving. All the antigens are also moving. At certain place, their concentration will become equal. Okay, at that place, the arcs will be formed like this, like this, like this, like this, like this. So again, arcs are forming. Here, who is moving? Both are moving. So it is double diffusion in 2 dimension. So this is double diffusion in 2 dimension. I guess you can appreciate. So we have taken the plain agar. In the center, we have taken the antibody. In the peripheral wells, we have taken the antigen. We have taken. So take agar, plain agar in the petri dish. Wells are cut. So antibody is placed in the central well. Antigens are placed in the surrounding well. Antigen antibody both will diffuse. That's why it's double diffusion in 2 dimension and arcs are formed. You can appreciate the arcs at the junction where their concentration become equal. Okay, so 4 things I told you. Single diffusion in 1 dimension, double diffusion in 1 dimension. Okay, single diffusion in 2 dimension, double diffusion in 2 dimension. Okay, antigen in the center and antibody in the agar. Sanskriti, technically you can do, but here basically we can take different antigen and 1 antibody. Okay, we want to test whether 2 antigens are for same antibody or not. But yeah, technically you can take multiple antibodies at the periphery and single antigen at the center. That's also you can do. Okay, ultimately arcs are important which are forming. One thing I have skipped. Let me tell you that thing also. You will understand, Sanskriti. So this is a double diffusion in 2 dimension. Now we use it to know what I told you, what we are taking in the center. In the center, we usually take antibody. Okay. And at the peripheral wells, we are taking the antigen. We want to know whether the 2 antigen are same or different. Let's take it. Suppose this is the central and central well. Okay. Let's do 3 experiment. Okay. This is the central well. Let me draw the peripheral wells. So suppose these are the peripheral wells. Okay. I will use one only. Suppose these are the peripheral wells. Okay, these are the peripheral wells. I'm drawing only 2 peripheral wells, although they are everywhere, but I'm drawing 2. So this contain antibody, this contain antibody, and this contain antibody. Okay, and this contain antigen. The peripheral wells are containing antigen. We want to know whether the 2 antigen into adjacent wells are same or different. I want to know whether this or this is same or different. In the 2 adjacent wells, the antigens are same or different. Okay. So basically the antibody will diffuse here like this. Okay. And both the antigens will also diffuse like this. Like this. Like this. Okay. So they will form the arcs. Now see. If the arcs are formed. Now see here. Sanskriti, see here. It was a good question, but this is your answer. So here the arc is formed. Here the arc is formed. After formation, if the arcs are fusing, the antigens are same. Okay. If the arcs after formation, they cross each other, they are not fusing, rather they are crossing each other. So these 2 antigens are different. So these 2 antigens are same. These 2 antigens are different. And the third possibility, they are neither fusing or nor crossing, like something in between. Okay, partial fusion like this. This is known as spur formation. So the 2 antigens are closely related. So there are 3 possibilities. Here the 2 arcs are fusing. Okay, this is known as fusion. The 2 arcs are fusing. Here the 2 arcs are crossing. And here the 2 arcs are forming the spur. Means partial fusion. So here the 2 antigens are same. These 2 antigens are same. Here the 2 antigens are different. They are completely different. And here the 2 antigens are partially same. They are not completely same. They are partially same. So this experiment, that is double diffusion in 2 dimension, we use to know that whether the 2 antigens in the 2 adjacent wells are same or not. You got it? Who was asking? Sanskriti. Okay. So this is the same thing I have shown you. Can you see it here? Can you see it here? So see, this is the central well, and the peripheral well. Appreciate the arcs. Okay. You can see here the arcs are fusing. Since they are fusing, so antigens are identical. Okay. Here the arcs are crossing. Since they are crossing, so they are unidentical. Okay. And here they are forming the spur. Since they are forming the spur, they are partially identical. Okay. They are partially identical. Antigens are many and antibodies only one. Make because it put in the center. Absolutely right, Sandeep. Okay, so this experiment we use for this purpose also. So that's why I told you that we take the antibody at the center and the antigens at the periphery, and we want to know whether the two antigens in the adjacent well, these two or these two or these two or these two or these two are same or different. So this is how we can use. So we are done with the 4 types of immunodiffusion. So I told you 4 types. The fourth one, what is the fourth one? Double diffusion in 2 dimension. The example of the fourth one is Alex precipitation test in diphtheria. You have to learn the corresponding examples also for your MCQ purpose, people. You have to learn the corresponding examples. So till now, I told you, let me summarize what I told you till now. Till now, I told you ring test. We perform single test tube and ring at the center. Okay. Example is Bacillus anthrax में Ascaris thermoprecipitant test and Streptococcus में lens field grouping. These are the 2 examples. Slide test, tube test. Example, here also syphilis, here also syphilis. But here VDRL test of syphilis, here Kahan test of syphilis, most important, repeatedly asked PYQ. In the immunodiffusion, there are 4 types of immunodiffusion. Single diffusion in 1 dimension, double diffusion in 1 dimension, single diffusion in 2 dimension, double diffusion in 2 dimension. The example of double diffusion in 2 dimension is Alex precipitation test in diphtheria. Okay, and last I am teaching you is electroimmunodiffusion. Can I come on the last one? The last one is electroimmunodiffusion. What do you mean by the term electroimmunodiffusion? Here it's immunodiffusion only. Okay, we will apply cathode and anode. That is, we will apply electricity, cathode and anode to make it fast. This one is slow. Okay, we will make it fast by applying the electricity. That immunodiffusion will convert into electroimmunodiffusion. So we are converting immunodiffusion to electroimmunodiffusion because we are applying electricity. Okay, and it's quantitative also. It is known as rocket electrophoresis. The other name of electroimmunodiffusion is rocket electrophoresis. You'll say, ma'am, what is this rocket electrophoresis? It's very easy. It's very easy. Take a petri dish. Okay, take a petri dish. Okay, and fill it with antibody incorporated agar. Mind my words. I'm not taking simple agar. I'm taking antibody incorporated agar. So antibody is everywhere. Antibody is everywhere. Take agar, heat the agar, mix antibody with a stirrer and cool it. Now this is known as antibody incorporated agar. Okay, this is antibody incorporated agar. Now cut wells here. Cut wells here. Small wells here. At the bottom, you cut wells and you put different concentration of the antigen. Okay, same antigen but of different concentration. Suppose here I'm putting 1 unit. Okay, 1 unit of antigen, 2 unit of antigen, 3 unit of antigen, 4 unit of antigen, 5 unit. So I'm putting antigen in all of them, but the concentration is different. Got my point? So this antigen will diffuse everywhere. Okay, here there is no space. I agree. So it will diffuse radially everywhere. So it will diffuse like this. It will go upward. So the point where their concentration become equal to the antibody, they will form the arcs. Here the shape of arcs is like this. Here you can appreciate what I'm drawing. The shape of arc is like this. The shape of arc is like this. The shape of arc is like this. So can you see the shape? Can you define what shape I have drawn? What is this shape known as? This shape is rocket. How we draw the rocket? So the shape of the arc is like rocket, and that's why it is known as rocket electrophoresis. Silly reason, but yeah, that's why it is known as rocket electrophoresis, because the shape of the arcs are looking like the rockets. Okay, and that's why it is known as rocket electrophoresis. But we are putting cathode and anode here. That's why it's very fast. Okay, that's why it's known as electroimmunodiffusion. We're getting my point. Listen. One more thing is important here. The length of the rocket. What do you mean by the length of the rocket? Listen. So here the length of the rocket. Appreciate, this rocket is small. This rocket is relatively larger. This is more long. This is more long. This is the longest one. So it depends on the concentration of antigen in the well. How much antigen you are taking in the well. So the length of the rocket corresponds with the concentration of antigen in the well. So basically it's a semi-quantitative method. Okay, so if the antigen concentration is not known to us, suppose I am having a sample in a test tube and the length, the concentration of this antigen is not known to me, I can use this method, and based on the length of the rocket, we can have a judgment that how much antigen is present in this specimen. It's a semi-quantitative method. How many of you got it? So you get MCQ questions here on rocket electrophoresis. There are 4 antigens: antigen A, antigen B, antigen C, antigen D. See their rockets. This is the rocket of A, rocket of B, rocket of C, rocket of D. Rocket is their arcs. So they can ask you the question, tell me which well is having the antigen in highest concentration, which well is having the antigen in lowest concentration. Tell me the sequence of concentration of antigens in the well, ABCD. So many questions can be framed, people. If concepts are clear now, you can answer any question in your NEET PG or INICT or any exam. People, concept remains same. Your concept should be solid. The point is that rectification holds good only for few days, few months. Ultimately it will evaporate. Rectification will evaporate one day. Concepts will never evaporate. Okay, so everything should be conceptual. You should understand the concept behind that. How many of you got it? And try to make the flowchart and diagrams as many as possible. Okay, so how to describe the rocket electrophoresis, people? So take a petri dish, write in your own language. Take a petri dish, take agar gel and incorporate antibody in that. So antibody incorporated agar gel. Okay, you are cutting the wells at the bottom. Put antigen in increasing concentration and use electrophoresis cathode anode. Okay, you will see the arcs will resemble the shape of the rocket. And that's why it is known as rocket electrophoresis. Not only this, the length of the rocket is directly proportional to the concentration of the antigen. I cannot write more easier than this. These flowcharts I have made for the simplicity so that you can retain it for longer. So we are done with the 5 type of precipitation. How many of you got it? How many of you didn't got it? Say. So what are the 5 type of precipitation? First you say, then only I will proceed. What are the 5 type of precipitation? Ring test, slide test, tube test, immunodiffusion, electroimmunodiffusion. And you have to learn their examples. You have to learn their examples. Okay. Can we move further? Okay. So we are done with precipitation. And now we are coming on agglutination. Can we come on agglutination? Let's start agglutination. So again, the definition and types. Lattice phenomenon holds good for both of them. Don't forget. Lattice phenomenon and zone phenomenon. You have to write in both. So coming on agglutination. What is the definition of agglutination? We already know. What is the definition of agglutination? Here the antigen is particulate. Instead of a soluble antigen, we are taking a particulate antigen. We are taking a particulate. Particulate means solid antigen. That's it. Other things are same. So here you can see we are saying.
Hello everyone. I hope you found this concept clear and easy to understand. If you would like to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLife by Dr. Priyanka. So join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.